So next, we're going to discuss a 67-year-old woman who goes to her primary care physician with a number of symptoms. She has fatigue, she has abdominal fullness, she has night sweats, and she's been losing weight. She's lost 17 pounds. On her past medical history, she just has hypertension. On physical exam, her spleen tip is palpable, about 7 centimeters below the left costal margin. Nothing else on exam. In terms of her blood count, she's anemic with a hemoglobin of 9.2. She has a normal platelet count, 189,000, and she has a leukocytosis with a white blood cell count of 19,000. So at that point, you know that the patient has a leukocytosis, anemia, and a big spleen. There's a very broad differential diagnosis here, and looking at the peripheral blood smear can be very helpful, because this could be a patient with chronic lymphocytic leukemia or mantle cell lymphoma or marginal zone lymphoma. So lymphomas can present like this. Even hairy cell leukemia can present like this. And so the peripheral blood smear might be very helpful with that leukocytosis if there are a lot of lymphocytes there, and you could perform flow cytometry on the peripheral blood to try to ascertain the diagnosis. Evidently that was likely not the case because she has a bone marrow biopsy. And the bone marrow biopsy shows class 3 or grade 3 fibrosis in the marrow, myelofibrosis. They do immunostains for CD34 and CD117 and find 1.2% blasts in the marrow. And they do a molecular analysis showing that the disease in the marrow is positive for a substitution or missense mutation in JAK2 called the V617F mutation. So the final diagnosis is primary myelofibrosis.